Facelift procedure. A facelift procedure tightens the skin of the face and the tissues beneath it to decrease the appearance of age indications such as wrinkles, skin folds, emphasizing the jawline and cheekbones, and removing extra fat beneath the chin. It is only performed for cosmetic reasons on ladies who want to look younger. Surgical dangers. The facelift operation carries a number of dangers, including the following. The wound is infected. There is a lot of bleeding. Scars around the incision. A significant reduction in blood pressure. Abrasion of the facial nerve. Facial edema, swelling. Prior to the procedure. Before executing a facelift operation, the doctor meets with the patient for a pre-consultation to ensure that the patient does not have any diseases that would prevent him from performing the procedure, as well as to describe the reasons for doing so. Some tests are performed on an as-needed basis, such as a complete blood count, a blood chemistry check, and in elderly people, a previous chest X-ray and electrocardiograph, ECG. You must inform your doctor about any drugs that must be stopped prior to the procedure, and you must refrain from drinking alcohol for 48 hours prior to the procedure and fast entirely for 8 hours prior to the procedure. During the procedure, according to the surgeon's experience, the amount of muscle and fat a person has, as well as the thickness and type of the skin, a facelift can be accomplished in a variety of surgical methods. 1. The place has been cleaned and disinfected. 2. An incision is made in the lower chin area, often along the jawline, to remove the skin in the neck and then lift it to reveal the muscle tissue beneath. 3. The surgeon tightens the muscle, then eliminates the skin and fat leftovers before repositioning the skin. 4. Other incisions are frequently made in the front and rear areas of the ears, and the same procedure is done in each location separately, depending on the amount of skin present and the degree of tightening required, and the procedure usually takes around 2 to 3.5 hours. 5. After the operation, the face is wrapped in an elastic bandage, and the surgeon may leave a drain tube or numerous tubes in place to drain the remaining fluid and blood from the tissues. Following the procedure. After a facelift, the patient is frequently detained in the hospital for 24 hours. To guarantee the stability of his condition, he must avoid tightening or bending the neck, as well as utilizing the facial muscles in the first few days after the procedure. The elastic bandage is removed after a few days, and bleeding and swelling under the skin may occur, but this normally subsides after 2 weeks. The patient's recuperation takes around 10 days, and the sutures are not removed because they are naturally absorbed. The patient's age, skin thickness, skin type, and elasticity are all factors that influence the outcome of a facelift. The healing time varies from person to person, and the full outcome of a facelift is often visible weeks, if not months, after the procedure.